Hey, COVID is showing up more and more in our wastewater, and that signals a growing number of infections in North Carolina. This after a confusing month of who can and cannot get the vaccine.
New tonight, WRAL's Ashley Rowe found out the law that kept people from getting the shot was actually meant to expand vaccine access. She went to the people in charge to find out what's being done to fix this unforeseen fallout.
A single sentence in a North Carolina law that created a flurry of frustration for people trying to get the fall COVID vaccine.
Went every route. I did everything that I was supposed to do, and we still weren't able to protect them. Don't take the tools away from us that allow us to protect our kids.
Until the state stepped in earlier this month, pharmacists were forced to turn people away from getting their COVID vaccine if they didn't have a prescription. It's because of a line in the Pharmacy Practice Act, which says pharmacists can administer vaccines recommended by the Advisory Committee on Immunization Practices. ACIP is a 20-member group within the CDC that develops recommendations for how and which vaccines are administered. That vaccine schedule you followed for you and your children is based on recommendations from ACIP. Look at the panel's policies and procedures. It's made up of people appointed by the Secretary of Health and Human Services who possess in-depth knowledge of vaccines and immunization.
So how does this fit into North Carolina law? The Board of Pharmacy tells me that after the height of the COVID pandemic, when pharmacists were really stepping up, the legislature wanted to expand their ability to administer vaccines. Instead of writing out every vaccine in the law, they broadened it, writing ACIP-recommended vaccines.
But in June, HHS Secretary Robert F. Kennedy Jr. removed all members and replaced them with his picks, delaying ACIP's COVID vaccine review all the way to late September. Without their recommendation, the law that was supposed to expand access restricted it.
So if the unforeseen confusion, unforeseen consequence has really created an issue, why not change it?
Well, and certainly that would be the legislature's priority to change that if they wish to do it. And I feel certain, Ashley, that there will be conversations about doing that.
Jay Campbell, the executive director of the North Carolina Board of Pharmacy, tells me the legislature could change the law to add different vaccine recommendations from other bodies, like the American Academy of Pediatrics. We sent emails to every lawmaker and leadership on the state Senate Healthcare Committee and House Health Committee. We asked them what considerations have been made to remove or amend the rule that forbids pharmacists from administering vaccines not recommended by ACIP. What's your position on this rule being enshrined in state law? And if you could make changes to vaccine policy in our state, what changes would they be? Not a single lawmaker answered our questions, despite us emailing them at least 3 times over a span of 2 weeks.
Other states are already changing their vaccine laws. California, Washington, Oregon, and Hawaii have created an alliance to provide unified vaccine recommendations. Similar efforts are being made in the Northeast. Ashley Rowe, WRAL News.
Well, you can find everything you need to know about the latest COVID vaccine, what doctors recommend should get it, who, I should say, and any new guidance about access to the shot on WRAL.com. Just search COVID.